we are in the home healthcare industry, but these principles kind of apply to every situation, because there's always going to be a door, and the door is usually right before you walk in to see a patient, right? So whether you're in home health, it's going to be a door before you enter into the home. Whether you're in the hospital, there's going to be a door before you walk in and meet the patient. Outpatient, doctor's office practice, there's a door before you walk in. There's always a door. And so here's one quick tip that I kind of like to do whenever I'm going to go see a patient or see someone for the very first time. I think about that door, and I think about they've never seen me and I've never seen them, but I want to make sure that I'm coming in a very humble state because I'm a guest. So I'll give you an example today. Walked in, this is home health, right? So I walked in, knocked on the patient's door, they opened, and they said, "Hi, how can I help you?" I introduced myself. I had my badge, and I said, "Hi, I'm Charles with Charlin Health Services. We're here to take care of your loved one." At this specific example, this was a hospice patient. Is it okay if I come in? And is it okay if I come in is essential, right? Because we are guests. It doesn't matter if you're in the hospital, doesn't matter if you're outpatient, doesn't matter. We are a guest because we're entering into their space, right? And so if we are honoring them and saying, "Hey, is it okay if I come in?" It's like, "Oh, wow, yeah." So they said, "Yes, please come in." The next thing is where I'm walking into their home, into their space. They let me into the home. So now imagine, say for instance, you're a doctor or a nurse in the hospital. You'll be knocking, and you would introduce yourself, and you say, "Hey, this is Nurse so-and-so. Is it okay if I come in?" Though that little phrase alone gives the respect and the autonomy to the patient. It lets them know that they are in charge, and they are. They're here. It's a service. It's customer service, right? So I walked in, said, "Hey, thank you so much." And I looked around the room. It was the home living room. And I was just scanning the room, talking to at this time, this was the medical power of attorney, and I said, "Wow, this is a beautiful house. Love your furniture." You know, try to compliment their space. You walk into the hospital, same thing. You walk in, say, "Hey, how are you doing?" You look at what's around their space. You look at the person, and you look at them. Maybe they may have a mug or some type of bag. They may be a Michigan fan. You say, "Hey, oh, are you a Michigan fan?" You see a little coffee mug or something. You try to compliment their space, compliment that area, because it makes them feel welcomed, right? And so I did that. It already kind of made them feel like, okay, this person's genuine. Body language, I'm open, right? I'm not scrunched up. I don't have a frown. My face smiling. I'm eye contact. I'm looking at them, looking at, what is their disposition. Are they scared? Are they afraid? Are they not sure? I'm looking and analyzing them and seeing what is their disposition to me, right? Are they worried? And I look at that, and then I address that from that perspective. At this specific example, this was a hospice visit, right? So I could see that they were tense. So I tried to make them feel comfortable way before I started talking about what it is that I was going to talk about, right? So you try to have to de-escalate the situation, really, to make sure that they feel comfortable, because they have to put their guard down in order for you to help serve them and educate them and give your expertise. So if you're watching this video, this is actually a short clip, and here is the longer clip, the actual full-length CarePods video. So please click on it. Click on it. Go ahead. Here.